Yes, so I had a great pleasure to lead a team and a project called Generation Green, which focuses on saving the environment, improving the cleanliness of the environment in one way. So our challenge was mainly focusing on the environmental load caused by pharmaceuticals, as we already heard, and pharmaceutical and the health risks related to pharmaceutical waste in particular. Primarily, there are two different primary routes how pharmaceutical waste may end up to the environment. The first route is via the improper disposal of unused medication. But this is kind of an easy problem, though, because by rationalizing the medical treatment, medical care, by taking good care of the proper disposal of pharmaceuticals, we can kind of easily solve this problem. But then there's also the inevitable, the pharmaceutical waste that is coming out of ourselves. Whenever we take a drug, it will be coming out of the body into the urine, and thereby it will eventually end up to the wastewaters. And unlike people usually think, the municipal wastewater treatment plants are actually not capable of removing the pharmaceutical waste, which is present at really, really low concentrations. But instead, the whole wastewater treatment system is targeted to a number of other chemicals. On the other hand, pharmaceuticals are known to be active and thereby really potent, even at really low concentrations, which may eventually lead to severe risks, what were already mentioned, like FIS behavior, altering FIS behavior, or even death. In extreme cases, eventually the pharmaceutical residues may, of course, even end up back to the human being. And our solution was mainly focusing on improving the sustainability and environmental awareness in pharmaceutical sciences by reforming the curricula, the education in the related fields, and also by reforming the policy making, by revising the current practices, but without forgetting the cutting-edge research and science basis, which of course is the key to progress in any field. So this was our main idea. And during the challenge competition and afterwards, we defined our goal in two different sub-themes, which were education, research, and policy making. Talking about the research first, which is probably the most obvious way to go. I mentioned that the municipal wastewater treatment plants are not capable of removing the pharmaceutical waste. But actually it is not even very efficient to remove the low amounts of pharmaceutical waste at the municipal wastewater treatment plants. But actually it should be done in those places where the pharmaceutical waste is the highest, where the concentration is the highest, meaning in the hospital, in the effluents of the hospitals, retirement homes, places where people use a lot of medicines. And in this respect, we've recently launched a new project together and in close collaboration with the Finnish Environment Institute, as well as Lappeenranta University of Technology, which focuses on developing new clean technology, targeting pharmaceutical waste and targeting exactly the local hotspots, hospital or wastewater treatment of hospital effluents and such places. This project has a funding total of about 1 million euros from TechES and 11 other funders from the private and public sectors. Another example of a recent research effort in which we are involved is from a slightly different field, also developing new technology, but it focuses on the molecules and their transformation in the body. Because what happens whenever we take a drug compound, it actually converts to a number of different other kinds of chemical forms in the body. But at the same time, most of the environmental monitoring studies focus on monitoring the parent compound only. And this is because of certain technical and technological limitations which we are trying to address in this project by developing new microarray technology in order to facilitate monitoring also the other relevant forms of pharmaceuticals in the environment. And thereby to be able to get a more comprehensive view of the actual environmental risk, which is currently being assessed and evaluated only on the basis of this parent compound, one single compound instead of multiple ones. And well, these are two examples of our recent research efforts. I'd also, as much as I'd like to say that we're also trying to develop biodegradable drugs, it is unfortunately something that is not so well feasible. It is kind of contradictory in the first place, because if we had a biodegradable drug, it would most likely degrade already in the body without taking the desired effect. So it is not so easy to develop biodegradable drugs, but instead in the future we will most likely be facing new diseases which will need new medicines, new treatments, for which we don't have any clean technology available, and for which we don't perhaps even know these transformation products. So therefore, we also put a really strong focus on educating the next generation, as the name says, Generation Green. And education and curricular reform is therefore another really key focus point in our work. In this respect, we have started already by educating the teachers, educating ourselves more or less, in order to learn and to be able to understand the environmental risks related to pharmaceuticals. We have also implemented sustainability and environmental awareness to the learning outcomes of the pharmacy degrees, and are planning to eventually continue to the second stage, meaning that we are bit by bit trying to reform the curricula so that the future scientists, future generations would have an inherent view of the environment, so that they could predict the environmental risks before they become problems at all. But then, no matter how brilliant our students are, no matter how good science we do, how good research we do, it does not have any effect if nobody knows about it. So therefore we have been rather active also in contacting all relevant stakeholders, politicians, pharma industry, and other healthcare professionals by inviting them into seminars locally and globally, and asking them to hear us out. What are the problems, what are the challenges presently, what might be the solutions now and what in the future? And we've been trying to share the information with them in order to have a clear route to the policy making so that it supports the change hand in hand with the developments in research and education. So in one sentence, I could summarize that in our case, less is definitely more. Less pharmaceutical waste means more money and better health in a way that our environment will be clean and we can ensure that it's clean and safe. And the direct outcome, of course, as we envision it, will be rationalized and personalized medical care, which immediately saves money. On the other hand, the clean tech that is targeting the pharmaceuticals exactly at the right place, exactly the right forms of chemicals, is of course saving a lot of money, but in addition to that, it clearly ensures the fact that the nature will be clean and secured from pharmaceutical and chemical waste. And like I said, beyond all of this, we still need the new generation in order to address those problems that are still presently unknown. So this briefly summarizes the work we've done during the past year or two. And I'm really happy to say that our team is still really, really active and as excited as in the beginning. And if you're interested in these topics, so you can follow us on the social media as well as via these two blogs that we're continuously running, one on the university website and the other one on the website of a national pharmacy association. Thank you for your time.